provide a service here for the 7 oil companies who make up the Warami organisation. We're on call 24/7. We just wait for a call from one of the sites to say that they have someone who needs to be evacuated to another hospital. We would then uplift them and take them down to Perth or into Karratha or Port Hedland for their tertiary care.
We usually start off with a meeting in the morning. We go through plane availability, equipment availability. We discuss any recent cases. We discuss weather with the pilots, and we discuss potential flights.
For a lot of workers in rural and remote areas, effective medical care is a key concern of theirs. Aspen Medical has got this program which allows them to receive very effective stabilisation and transport through to high levels of care in the major cities. Most frequently we call to Priority 2 events, which are patients who require hospitalisation at a high-level facility that we don't have here in the Pilbara. Occasionally we'll get a Priority 1 event, which is a true life-threatening event. Part of the package is providing a high level of medical care for the duration of that flight, and that can have its own challenges.
If an incident happens on a large mining site or any other site in town, we respond to that, bring the patient to hospital, and if the patient requires further treatment, we hand over to Aspen Medical. It's good to know that the further treatment they're going to get is always going to be beneficial for the patient, and to know that they're in good hands.
In my role as a pilot, it's my responsibility to make sure that the aircraft and all the crew on board are safe at all times, and we operate the aircraft safely from point A to point B. It's really nice to be able to be part of a team. It gives you a sense of purpose, really making a difference in people's lives.
Over the years, it's not only just a single AME. We may get a call while we're on an AME and pick up another patient. We can carry 2 patients or indeed 3 patients at any one time. We've also been flying when we've had multiple call-outs, in other words back-to-backs. We've had a few occasions where we've had 5, 6, even 7 in a row over a space of 48 to 72 hours, depending on what the patient priority is. We're quite flexible.
Experiences have been varied, from minor cases to the most severe. Patients that should not have survived, but with early prompt intervention and medical care have made very positive recovery.
Just the other night, we had a case where a young man came in, had an industrial accident out of the port. His ankles were crushed. The whole team came together. We're working with the ambulance drivers, with the paramedics, helped them get in the aircraft in a succinct amount of time, and then flew them to Perth. His mother was there. She had a big smile on her face. Her son was delivered safely to the hospital. Just seeing her happy and seeing the guys survive is what it's all about.